Hello everyone and welcome back. Today we are going to talk in detail about one of the most commonly used medicines in the world, a tablet that almost every household has in its first aid box, and that is Panadol. Many of you may already know Panadol by name, or may have used it before for headaches or fever. But in this session, we are going to explore it very deeply so that you not only know what it does, but also how to use it safely and why it is so widely trusted. Panadol is a brand name for the medicine called Paracetamol. And in some countries, especially in the United States, you might hear it called acetaminophen. So remember, when someone says Paracetamol or acetaminophen or Panadol, they are usually talking about the same medicine. This medicine has been used for decades, and it is considered one of the safest and most effective options for mild to moderate pain relief and for reducing fever. Now, why do people use Panadol so often? The main reason is because of two important actions. First, it helps to reduce pain. Second, it helps to lower fever. These are two very common problems in daily life. Almost everyone at some point experiences headaches, toothaches, body pain, or fever due to infections like colds or flu. Panadol works by acting on the brain where it blocks chemical messengers that produce the feeling of pain, and it also acts on the part of the brain that controls body temperature, which is why it helps to bring down fever. Let us start by discussing the types of problems people usually treat with Panadol. If you have a simple tension headache after a long day of work, Panadol can give you relief. If you have a toothache or after dental procedures like tooth extraction, Panadol is often recommended because it is gentle on the stomach compared to other painkillers. Let's start by discussing the types of problems people usually treat with Panadol. If you have a simple tension headache after a long day of work, Panadol can give you relief. If you have a toothache or after dental procedures like tooth extraction, Panadol is often recommended because it is gentle on the stomach compared to other painkillers. For muscle aches or back pain caused by long hours of sitting or exercise, Panadol again provides relief. Women who suffer from menstrual cramps or period pain also use Panadol to manage discomfort. People with mild arthritis or joint pain sometimes find it useful. And of course, one of the most common uses is when you have fever due to infections like flu, cold, or even after getting vaccinations. So you can see that Panadol is really versatile. It is not meant for severe pain like post-surgery pain or very strong arthritis pain, but for everyday common issues, it is very effective. This is the reason why doctors, pharmacists, and even parents often keep it handy. Now let us talk about the dosage, because this is very important. For adults, the typical dose is 1 to 2 tablets every 4 to 6 hours is needed, but the total amount in 24 hours should never exceed 8 tablets, each regular. Panadol tablet usually contains 500 milligrams of paracetamol, so if you take 2 tablets, that makes 1 gram, and the safe maximum per day is 4 grams. Going beyond that can be very dangerous because of the way Panadol is processed by the body. The liver is the organ that breaks down Panadol, and when you take too much, it creates harmful byproducts that damage the liver sometimes. People think if 1 or 2 tablets help, then maybe more will help faster, but that is not true. Instead, it puts the liver at serious risk. What makes this dangerous is that overdose symptoms may not appear immediately. In the first hours, you may just feel normal, or maybe a little unwell. But inside, the liver damage is building up by the time symptoms like nausea, vomiting, abdominal pain, or yellowing of the eyes appear. The damage may already be severe, and even life-threatening. This is why we always say never exceed the recommended dose for children. The rules are different. Panadol is available in syrup form or chewable tablets, and the dose depends on the child's weight and age. It is not one size fits all, so parents must always check the packaging or consult a pharmacist before giving it children. Livers are more sensitive, so extra care is needed. For babies and infants, special liquid drops are available, and those doses are measured in milliliters using a small syringe or spoon included in the pack. Again, accuracy is key. Let us clear a common misconception. Many people believe that Panadol is so mild that it can be taken anytime in any amount. They see it as harmless compared to stronger medicines. But this is not correct. Panadol is safe when used properly, but if misused, it can be one of the most dangerous medicines because of the risk of silent liver damage. In fact, hospitals often see cases of accidental overdose, especially when people mix Panadol with other medicines without realizing it. This brings me to another very important point. Many cold and flu remedies available in pharmacies already contain For example, combination sachets or tablets for flu relief may contain paracetamol, along with caffeine or antihistamines. If you take those plus Panadol tablets, you may end up doubling the dose by mistake without even knowing it. That is why you should always read the label carefully and check if paracetamol is already included. Now let us talk about side effects. Compared to other common painkillers like ibuprofen or aspirin, Panadol is generally very gentle. It does not irritate the stomach lining, so it is suitable for people who have ulcers or stomach sensitivity. It also does not thin the blood the way aspirin does, so it is safer for people who have bleeding risks. However, although side effects are rare, they can still happen. Some people may develop an allergic reaction. This could show as skin rashes, itching, swelling, or in severe cases, difficulty in breathing, which is a medical emergency. In such cases, Panadol should be stopped immediately, and medical attention is needed. Another group of people who need to be cautious are those who drink alcohol regularly or those who have existing liver disease. Since both alcohol and Panadol are processed by the liver, combining them increases the risk of damage. Even if you are not a heavy drinker, it is always better to avoid alcohol while using Panadol. What about use in pregnancy and breastfeeding? Panadol is actually considered one of the safest painkillers during pregnancy, and many doctors recommend it as the first option for pain and fever. However, it should still be taken only when necessary and at the lowest dose possible for the shortest time. The same goes for breastfeeding mothers, because small amounts can pass into breast milk, but they are generally considered safe. Now let us talk about different formulations of Panadol, apart from the standard 500 mg tablets that are also extra strength tablets which contain a higher dose. Sustained release tablets that last longer, chewable tablets for children in syrups, or liquid suspensions. For younger children, there are even Panadol products combined with caffeine which provide extra relief for headaches and tiredness. Each type has its own instructions, and again it is very important to follow them carefully. Another practical point is about storage. Panadol should be kept in a cool, dry place, away from direct sunlight and always out of reach of children. Many cases of accidental poisoning happen when children find tablets lying around and mistake them for candy. If a child swallows a large number of tablets, it becomes a medical emergency, and immediate hospital care is needed. Sometimes people ask if Panadol can be taken every day. The answer is that it depends. If you have occasional pain or fever, it is fine to take it as needed, but if you find yourself needing Panadol every single day for weeks, then you should not rely on it. Instead, you should see a doctor to find the root cause of the problem, because Panadol treats symptoms but does not cure the underlying disease. For example, if you have daily headaches, maybe you need an eye checkup, or maybe your blood pressure is high. In such cases, continuous use of Panadol only hides the issue without solving it. I would also like to highlight the difference between Panadol and other painkillers like ibuprofen or aspirin. Ibuprofen works by reducing inflammation, so it is better for conditions like sprains, arthritis, or swelling, but ibuprofen can irritate the stomach and may cause kidney problems in some people. Panadol does not reduce inflammation much, but it is gentler and safer for most people, especially those with stomach or kidney problems. Aspirin is another common painkiller, but it can cause stomach irritation and increase the risk of bleeding. Panadol does not have those risks, so depending on your health condition, Panadol may be the safer choice. Another interesting fact is that Panadol is one of the most widely studied medicines in the world. Its safety profile is well established, and it is on the World Health Organization list of essential medicines, meaning it is considered a basic requirement for every healthcare system around the globe. This shows how important and trusted it is. Now let us think about some real-life examples. Imagine you have been working all day staring at the computer, and by evening you get a dull, throbbing headache. You do not want to take something too strong because you still need to continue with your work. You take 1 or 2 Panadol tablets with a glass of water. Within about 30 minutes to an hour, you start to feel better and you can carry on with your tasks. Another scenario: a parent has a child with fever. After vaccination, the child is uncomfortable and crying. The parent gives the appropriate dose of Panadol syrup based on the child is swayed. Within a short time, the fever comes down and the child feels more comfortable. These simple examples show why Panadol is trusted in daily life. But remember, Panadol is not a solution for everything. If you have very high persistent fever, severe pain, or pain that keeps returning again and again, you should not keep taking Panadol endlessly. Instead, you should consult a doctor, because those symptoms could be a sign of something more serious that needs proper treatment. So to wrap this long discussion, let us review what we have learned. Panadol, also known as paracetamol or acetaminophen, is a safe and effective medicine for relieving pain and reducing fever. It is widely used across the world for headaches, toothaches, muscle aches, back pain, period pain, mild arthritis, and fever. It works by blocking pain signals in the brain and by reducing temperature in the body when taken in the right dose. It is safe for most people, including pregnant and breastfeeding women and those with sensitive stomachs, but it must always be taken responsibly. Never exceed the recommended daily dose, because too much can cause serious liver damage. Always check labels of other medicines to avoid accidental double dosing. Store it safely away from children, and do not combine it with alcohol if you need to. Take it frequently or for a long time. Consult a doctor to check the underlying cause.